You're doing well. It's right. Beautiful. Looking straight ahead. Don't need to keep the other eye. Great. Any other treatment on your eyes than the cataracts?
No, that's about it.
That's about it? How long ago was that? Was that more
I think that I got involved to try to help close the gap when I was looking at healthcare variation in Australia on behalf of the federal government, and it's just unacceptable in Australia at the moment for there to be such a discrepancy in healthcare delivery for people depending on where they live and what sort of healthcare access they have. G'day Gerald, how do you go?
I'm going well. Hi, Torres.
Gerald, this is Professor Andrew Chang, who's a vitreoretinal specialist. Andrew, Gerald is from Moree, and he had a major problem with his eye when I saw him up there and was unable to access appropriate treatment.
We know more than ever now that the patients, their families and their communities are critical to the delivery of eye care. So we focused on several areas for future development. How do we collaborate with people working in this space so we can do more together? How do we engage the community? And what ways are there? So we are looking now at virtual ways of connecting with patients electronically. We also are now identifying those communities which really need care. In developing this, we've worked closely with our colleagues at Prince of Wales, who over many decades have provided service to remote locations. And in this latest initiative, we are working very closely with them, as well as other stakeholders, such as the Brian Holden Foundation, the Rural Doctors Network, and also optometrists who are at the coalface.
So the program that we've set up is supposed to address all problems, and so providing eye care services throughout New South Wales, no matter where you are, but also providing the opportunity to come down to somewhere like the Sydney Eye Hospital where you have access that everybody should have to be able to get the appropriate eye care. But the Sydney Eye Hospital offers more than that. There is a special Indigenous eye clinic that is being established with some terrific Aboriginal liaison officers who just smooth the pathway and allow our patients to feel comfortable in the environment. We also will have a telemedicine set up so that patients who come here, who have surgery here, will be able to get appropriate follow-up with telemedicine without having to come all the way back to Sydney.
It shows that the risk to sight has been settled with treatment that you've had in the past with laser, and your central sight is actually pretty good.
So the first thing we need is some ophthalmologists, although I must say that the response whenever I ask an ophthalmologist whether they want to help, the answer is almost indefinitely yes. What they're really looking for is a structure that they can work within, and that's what we're setting up at the moment. And the second critical thing that all programs need is financial support. And so without that, we can't have the clinic set up the way we want to at the eye hospital. We can't have the telemedicine equipment so that we can connect with patients in Burke, Broken Hill, Moree, Griffith, Dubbo, Wilcannia, wherever. So they don't have to travel and they can get their assessment done. And if they need to have a major surgery that can't be done locally, then we can organise that and they can come down to the Sydney Eye Hospital. But what we really need is financial support from people who share the vision that, that everybody in Australia should have access to the same level of eye care, no matter who they are or where they live.